The Pulmonetics Systems laptop ventilator offers both volume and pressure ventilation. When volume ventilation is selected, all machine and assist breaths are volume control breaths. Breaths are given according to the tidal volume and inspiratory time controls. When pressure ventilation is selected, all machine and assist breaths are pressure control breaths. Breaths are given according to the pressure control and inspiratory time controls. The LTV can provide the following modes of ventilation: control, assist control, SIMV, CPAP, bilevel, and non-invasive positive pressure ventilation. It also has an apnea backup mode. Let's look at control ventilation first. In the control mode, volume or pressure control breaths are given at the rate specified by the breath rate setting. No patient-triggered breaths are allowed. In the assist control mode, the ventilator guarantees a minimum number of volume or pressure breaths. The patient may trigger additional volume or pressure-controlled assist breaths. Here you can see that the third and fourth breaths were patient-triggered. SIMV stands for Synchronized Intermittent Mandatory Ventilation. In the SIMV mode, machine, assist, and patient breaths may be given. For the first patient trigger detected within a breath period, an assist breath is given. For all subsequent patient triggers within the same breath period, patient breaths, either spontaneous or pressure-supported, are given. At the beginning of a breath period, if no triggered breaths were given in the previous breath period, a machine breath is given. In the CPAP mode, there is no set breath rate. When a patient trigger is detected, either a spontaneous breath or a pressure support breath is given, depending on the pressure support setting. The graphic on the left shows the CPAP mode with pressure support set to 15. The graphic on the right shows the CPAP mode with pressure support set to 0, PEEP set to 5. Here we see bilevel ventilation in the CPAP mode. In this mode, the breath rate is turned off, pressure support is set to 15, and PEEP is set to 5. When a patient trigger is detected, a pressure support breath is given. The LTV can be used in both invasive and non-invasive applications in a variety of ventilation modes. Non-invasive ventilation can be provided with the LTV in any mode. For non-critical patients, the clinician may choose the NPPV mode to reduce the number of active alarms. In the NPPV mode, only the following alarms are active: high pressure, apnea alarm and apnea backup ventilation, sense line disconnect, external power lost, internal battery low, internal battery empty, vent in-op, and defaults. The LTV provides an apnea backup mode of ventilation. Apnea backup ventilation begins when the time since the last breath start is greater than the set apnea interval. When an apnea alarm occurs, if inspiration is in progress, the ventilator cycles to exhalation. The ventilator begins apnea backup ventilation in the assist control mode, according to the control settings. The active controls are displayed at full intensity, and all other controls are dimmed. The breath rate for the apnea backup mode is determined as follows. If the set breath rate is greater than or equal to 12 breaths per minute, the apnea breath rate is the set breath rate. If the set breath rate is less than 12 breaths per minute and the set breath rate is not limited by other control settings, the apnea breath rate is 12 breaths per minute. If the set breath rate is limited to less than 12 breaths per minute, the apnea breath rate is the highest allowed rate. The ventilator exits the apnea backup mode and returns to the previous mode of ventilation when the operator resets the apnea alarm or the patient initiates 2 consecutive breaths.